My friends, I want you to take a deep breath right now, because what I'm about to share with you is something that thousands of seniors across this country have been reaching out about this week. And I mean thousands. The phones at local Social Security offices are ringing off the hook. People are logging into their My Social Security accounts and staring at numbers that look just a little different than what they expected. Some folks are seeing a few extra dollars they didn't anticipate. Others are seeing deductions they never got a letter about, and almost everyone is asking the same question. What in the world just happened to my April payment? I want you to know you are not alone in this. And more importantly, you are not imagining things. Something did change. Something new did hit April payments, and today I'm going to sit down with you and walk through every single piece of it in plain English. No government jargon, no confusing bureaucratic language. Just one friend explaining it to another, the way it should have been explained to you from the beginning. Whether you're on Social Security retirement, SSI, SSDI, or you're a veteran receiving VA benefits, this update touches almost every category of beneficiary in some way. So please stay with me through this entire video, because I promise you, by the time we're done here, you are going to understand exactly what happened, what to expect going forward, and what steps, if any, you might need to take to protect your monthly income. Let's get into it together. Now, the first thing I want to clear up is this. April is not just another month in the Social Security calendar. It never is. April is typically when several adjustments that were quietly announced earlier in the year finally begin showing up in actual payments. And that's exactly what's happening right now. You'll remember that at the start of 2025, the Social Security Administration officially applied a 2.5% cost of living adjustment, what we call the COLA increase. For most retirees, that adjustment was supposed to show up beginning with January payments, and for the majority of people, it did. But here's what a lot of people don't realize. The way Social Security calculates and applies adjustments isn't always a clean, simple, one-time change. There are Medicare premium offsets, income recalculations, earnings record updates, and in some cases, retroactive corrections that trickle in over the first few months of the year. So when some of you opened your bank statements in early April and noticed your deposit looked slightly different from what you received in March, that is very likely one of these downstream adjustments finally landing. It can feel alarming because nobody sent you a big red letter explaining it. But this is actually part of a larger pattern that the SSA does every single year, and most of the time it works in your favor. Let me give you a real example. A woman I'll call Margaret, she's 71, lives in Ohio on a fixed income, noticed her April direct deposit was $34 higher than her March check. She called her daughter in a panic because she was afraid it was a mistake and that the government would come back to claw it back. But after doing some research, she realized her Medicare Part B premium had been recalculated slightly downward based on her 2023 income, which freed up more of her COLA increase to actually hit her account. That $34 wasn't a mistake. It was money that was always hers, finally being delivered correctly. Now I want to be balanced with you here, because not everyone is seeing more money. Some of you are seeing less, and that deserves an honest conversation too. Let's talk about the harder side of this, because I believe you deserve the full truth and not just the good news. Some seniors are seeing lower than expected April payments because of what's called a benefit offset, and this happens more often than people realize. One of the most common reasons right now is an income-related monthly adjustment amount, which the government calls IRMAA A. If your income from 2023 was above a certain threshold, roughly $103,000 for individuals or $206,000 for couples, the Social Security Administration coordinates with Medicare to increase your Part B and potentially your Part D premiums. And because those premiums are deducted directly from your Social Security check, a higher premium means a smaller deposit in your account. The tricky thing about IRMAA is that it's based on income from 2 years ago. So even if your income dropped significantly in 2024 or 2025, say you retired, lost a spouse, or had a major medical expense, you could still be paying higher premiums based on older income data. The good news is that you have the right to appeal this. You can file what's called a life-changing event appeal with Social Security, and if you can document that your income has genuinely dropped, They can adjust your premium right away rather than making you wait. There's also the issue of overpayment recovery. This is something that's been in the news recently, and I want to address it head on. Over the past few years, the SSA has sent out a significant number of overpayment notices, cases where the government says it paid someone more than they were entitled to, sometimes through no fault of the beneficiary. In the past, the SSA could withhold 100% of your benefit to recover an overpayment, which was devastating for people living on a fixed income. But following public pressure and congressional scrutiny, the SSA announced updated guidelines that are still being implemented, limiting the default withholding rate to 10% of your benefit unless you agreed to a higher rate or were found to have committed fraud. If you received an overpayment notice and nobody explained your options to you, I want you to know that you have the right to request a waiver, especially if repaying the money would cause you financial hardship. You also have the right to appeal the overpayment decision itself if you believe it was issued in error. Do not ignore these notices, but also do not panic. There are protections in place for you. Now, let me speak directly to those of you who receive supplemental security income or Social Security disability insurance, because your April situation has some unique elements worth understanding. For SSI recipients, the federal benefit rate in 2025 is $967 per month for individuals and $1,150 for eligible couples, following the 2.5% COLA. But here's something that often gets overlooked. Your actual SSI payment may be higher or lower than that federal base rate depending on your state. A number of states supplement SSI with additional state payments, including California, New York, Massachusetts, and others. If you live in one of these states and you're not receiving the full combined amount you're entitled to, that's worth looking into through your local SSA office or your state's Department of Social Services. For SSDI recipients, April is important because many of you may be approaching or tracking toward what the SSA calls substantial gainful activity thresholds, the income limit that determines whether you're still eligible for disability benefits if you're doing any kind of work. In 2025, the SGA limit for non-blind individuals is $1,620 per month. For those who are statutorily blind, it's $2,700 per month. If you're working part-time or doing any freelance or gig work to supplement your SSDI, please keep these numbers in your mind because exceeding them, even briefly, can trigger a review of your eligibility. Also worth knowing for SSDI recipients, if you've been on disability for 24 months, you automatically become eligible for Medicare, regardless of your age. Some people don't realize this until years later, leaving valuable health coverage on the table. If you've been on SSDI for 2 years or more and you're not enrolled in Medicare, please call the SSA directly or visit ssa.gov to get this sorted. For our veterans in the audience, and I know many of you watching are receiving both VA disability compensation and Social Security, I want to make sure you understand how your April payments fit into the bigger picture. VA disability compensation is completely separate from Social Security. It is not taxed. It does not count as income for SSI purposes, and it is not subject to Medicare premium deductions. So if you're a veteran receiving VA compensation, your April VA payment should have reflected the 3.2% cost of living adjustment that was applied to VA benefits at the start of the 2025 fiscal year, which is actually slightly higher than the Social Security COLA of 2.5%. That means your VA check should be modestly larger than it was a year ago. Now, for veterans who are also receiving Social Security Retirement or SSDI, I want to flag something that can be confusing. If you qualify for VA Individual Unemployability, often called IU or TDIU, you can receive VA compensation at the 100% disability rate even if your medical conditions individually don't add up to 100% on the VA's rating schedule. And crucially, VA compensation at 100% does not affect your Social Security benefit. These two streams of income can and do coexist, and many veterans are leaving significant money on the table simply because they haven't applied for the VA rating they're entitled to. If you're a veteran and you've never had your VA disability rating formally evaluated or updated, or if your health conditions have worsened since your last rating, I would strongly encourage you to reach out to a veteran service organization like the DAV, the VFW, or the American Legion. They provide free claims assistance, and they know how to navigate the VA system in ways that can make a real difference in your monthly income. Now, I want to share something that most people never hear about, and that's the strategies that exist within the system to help you get every dollar you're entitled to. The first one is the windfall elimination provision and the government pension offset. Two rules that have reduced Social Security benefits for millions of public sector retirees, teachers, firefighters, and police officers for decades. After years of advocacy, Congress passed and the President signed legislation in late 2024 repealing both of these provisions for most affected retirees. This is a significant change. If you or your spouse worked in a government job that didn't pay into Social Security, a state or local government position, and you've been receiving a reduced Social Security benefit because of WEP or GPO, you may now be entitled to a higher benefit. The SSA is still processing these adjustments for eligible beneficiaries, which is another reason some April payments are looking different for certain people. If you think this applies to you, call SSA directly, because this correction does not happen automatically for everyone. Some cases require you to initiate contact. The second strategy I want to talk about is the Earned Income Tax Credit for older workers. If you're between 65 and certain income thresholds and you have any earned income, even from part-time work, you may qualify for the EITC, which changed its rules in recent years to include more seniors. This is a tax credit, not a benefit reduction, and it can put real money back in your pocket at tax time. And finally, I want to say this clearly. If you have not yet enrolled in Extra Help, which is the federal program that reduces your Medicare Part D drug costs, please look into it. In 2025, the income and asset limits for Extra Help were expanded, which means more seniors qualify now than did just 2 years ago. If your drug costs are eating into your monthly budget, this program can save you hundreds or even thousands of dollars per year, and it does not affect your Social Security check. My friends, I know this is a lot of information. And I know that when you're living on a fixed income, every single dollar matters. Every change to your check, whether it's $12 more or $40 less, has a real impact on your life, on whether you fill your prescriptions this month, on whether you turn the heat up or keep an extra sweater on. I understand that. And I never want you to feel like you have to navigate these changes alone. What I want you to take away from today is this. Something did change in April. But for most of you, it is explainable. It is understandable. And in many cases, it may actually be working in your favor. You just needed someone to translate what's happening. That's what I'm here for. If you found this video helpful, please share it with a senior neighbor, a parent, a spouse, a sibling, anyone who might be sitting at their kitchen table right now, confused about why their check looks different. They deserve to know what you now know. And if you have specific questions about your situation, a clawback notice, a VA rating question, an IRMA A appeal, drop it in the comments below. I read every single one, and your question might just become the topic of our next video. Until then, take care of yourself, take care of each other, and remember, you earned every dollar of what's coming to you. Don't let anything take it without a fight. I'll see you in the next one.